Hi, I'm Tim Wiedrich. I'm Section Chief for the Health Resources and Response Section with the North Dakota Department of Health. I know there's been a lot of discussion about hospital bed availability within North Dakota, and I want to bring a little bit of clarity about what that actually means. When we talk about hospital bed availability, what we're really talking about are staffed hospital beds. In other words, not just the number of beds in a hospital, but really how many beds can effectively be providing patient care. So with hospital bed availability, meaning staffed beds, what we've done in recent times is pulled information directly from the hospitals that are reporting that information to us on a daily basis. So every day the hospitals go in and they indicate how many general hospital beds are available, and by that again that they would have staffing for. But then in addition to that, how many ICU beds are also available within the facility. Now some of the smaller facilities don't have separate ICU beds, and so that's going to vary a little bit depending on the hospital. And the hospitals actually declare on their own how many ICU beds exist within each facility. So there's going to be some variance in terms of not all hospitals have declared ICU beds, but many of them do. As far as how the reporting goes, it's really a website that hospitals have login information, and they provide that information back to the state health department. We pull that information then off of the website that the information is collected from. It's always just a snapshot in time, and so when we do a report back out from the health department, it's as of a specific date and on a specific time within that date. Now the hospitals themselves keep reporting that information on an ongoing basis, and so they may be able to go in and look actually at the website itself and see that the times are changing, and so they have more of a real-time environment that they're functioning in. But when we issue a report from the health department out, that's really just a snapshot in time on a specific day and as of a specific time frame that the hospitals created the report. There are a wide variety of steps that hospitals can take when we start to run into situations where hospital capacity is filling up. And so there's a statewide plan that's been developed that really has several tiers associated with it. The first tier is what I call blue, clear sky. It's the normal operating conditions when there is no emergency. And so at the beginning of the COVID response, hospitals did an estimate, or basically did some planning activity back in April that estimated what they would normally have for hospital bed availability under normal operating conditions. And then we began planning with the hospitals how much capacity hospitals could create by making some additional staffing changes, bringing in additional staff from that they may have access to, or utilizing their physical space in a little bit different manner. And so that's the next tier in terms of what they could surge to. There's a tier above that yet that would call for some pretty dramatic measures, so things like changing the ratio of patient providers to the number of patients, or extending the number of hours that staff are working within a hospital to actually create some additional capacity within those facilities. And there likely in our planning processes will not be a limitation in terms of the physical space of the hospitals. It's really more a question of how much staff can be found to function within the hospital to actually provide the care. So that last tier that I talked about really is starting to take some pretty dramatic steps in terms of increasing capacity by canceling elective surgeries and changing staffing ratios and extending hours. There's another category, the final category, that really isn't a hospital level at all, but it's called a minimum care facility. And that's the establishment in gymnasium or auditorium styles of care facilities that really are providing hydration, nutrition, hygiene, and some ventilation support, some airway support. And that would be provided by lead hospitals within each of the 8 major communities. But then in addition to that, the Medical Reserve Corps, of which there's about 1,400 people, had raised their hand and said, in an emergency, send me. So we would draw on those folks, plus whatever volunteers or family members would be willing to provide care in that setting. We are nowhere near those final steps at all, but that's part of an ongoing planning process that the states had in preparation if in fact things became much more severe than we're anticipating. There really isn't a need to be concerned. Hospitals are in fact managing this process. They are stressed, make no doubt about that. They're taking measures to accommodate the increased patient load, which is not just because of COVID, but because of other types of hospitalizations. Trauma levels are up, medical emergencies such as heart attacks and diabetes or stroke. Those situations are all right now increasing hospital bed capacity, and so that is being dealt with. But I think that members of the community, members of the public, really need to take to heart that there's a role that you can play. And that is that by directly participating in social distancing, in masking, those types of activities really do reduce the level of hospitalizations that are needed and that are currently stressing the system. And so we have a responsibility to others, to the rest of the community, to take those steps to assist by taking the social distancing steps that are necessary. We will overcome this, but we need to do it together.